Hey everybody, welcome back to the Clinical Trials Guru.com. Welcome back, Guru Nation. We're live streaming Facebook Live. So, this is an impromptu interview with two students. We got Dare, we got Kolade. They finished the CRA Academy. You guys were in the April, May, and June. So they just finished in June. Now they started their internship. We're here in August 4th. And so, just first of all, let me know why you wanted to be a CRA, and we'll make this a quick interview. Both of you guys, why did you want to be a CRA in the first place?
To me personally, I enjoy traveling. That's number one, because with CRA, you're able to go wherever you want to go.
Correct, lots of travel.
People, so that's one of the basic things that you want to.
Okay, and you, sir? Birthday boy, by the way,
Yeah.
birthday.
Yeah, today's my birthday, everybody. How
Right.
you doing? Yes. One of the reasons I want to be a CRA, I've been a project manager, qualified as a PMP for a while, which is a monitoring job. So CRA is something very close and similar to monitoring. Of course, pharmaceutical industry, you make more money. So that's one of the reasons I want to go there.
Good, respect, right, and respect that as well. So, what did you learn? What did you learn with the CRA Academy? I mean, going into the academy, did you have any knowledge of monitoring at all?
Actually, to be honest, I do not have the knowledge until when I joined the CRA Academy, because I work in the lab for 10 years. I've been dealing with some of the CRA, sending an email, but I could not understand what they are saying. Sometimes they would like, okay, why do you have to generate this query?
Yeah.
But when I joined the CRA Academy, it now makes sense to me that, okay, there's some things they are looking that I don't even pay attention to.
You understand the bigger picture now.
Yeah, now, especially there's something they call the source document. So now when I look at that, now makes sense to me. Okay, these people are doing this for a reason. So now I think I'm ready.
I'm ready
to go.
And now that you started the internship, and you as well, Kolade, what was the hardest thing for you to learn from the academy or from the internships in general? What were some of the challenges?
Going back to if I have a prior knowledge of what CRA, I did a class, took a class earlier in the year. I'll be honest with you, I did not grasp it the way I grasped it when I was now with our CRA Academy. It made the way the teaching partner made it so practical, so that you can actually you'll be able to relate to whatever they're saying, because they're going to show it to you, and I was able to really, at least I was able to pull through.
Okay. And so what was some of the most challenging aspects of the academy for you guys, or during the internship?
I think, to me, the time. I think I need more time also, because it's kind of a little too short, because working full time, then trying to get yourself in the class is already a challenge. So if anybody want to come in, I would say, try to devote time. Time matters on this class. If you can have the time to go through your materials that the teacher sent before the class, that will give you more prepared. Because if you wait until the class starts before you start going through the material, that's going to cause a lot of problems. So, and again, another thing I realized that, okay, after the class, again, after we finish the program, I still have access to the intro links, to all the material. So right now, at least once in a week, I still go back into the video and reverse what we've been doing. So now it's now sinking into my body.
It's repetition. So what are you still struggling with? I mean, just be honest. What are some of the concepts you're still struggling with? Because other people out there might be in the same situation.
Right now, I'll be honest with you, there's still a lot to catch up with. But when you get into the industry, we've been told every now and then that you still gonna find a way of doing things, that the best way that's gonna work better for you than the way things has been done. Sometimes if you don't, especially because we have a lot of different studies and everything, you may not be able to cover all the therapeutic area. So because different study with different protocol and everything.
Correct.
So I would say one needs to be patient. I have to dedicate more time and you have to keep, try to get yourself familiar with the protocol as much as you can.
And really quick, just 2 more minutes left because these guys gotta go. A couple of our students already went out to get hired, and so if you're having a hard time getting hired as a CRA, you may want to try to get hired as a clinical project specialist, clinical trial assistant, even a research coordinator. I was telling these guys, get yourself in the industry. You need experience on your resume, okay? Any QA these days, and I know we're working on getting gigs for our CRO, so people are like sort of following the journey, and they're seeing how we're getting new gigs. And what I'm noticing is the future of monitoring, and I've talked to people at Scope, you guys are going to actually learn from the ground up.
That's great.
What it takes from the coordinator level, or even beneath, up to being a CRA. That's right. So you're going to learn the technical stuff, but you know what's becoming more important than the technical stuff is the emotional intelligence. Right? We have a client in the Midwest, and she has her interns going out and finding doctors for her site. And these are going to be future CRAs. They're developing their emotional intelligence, right? So that's becoming increasingly important in this industry because the other stuff is commoditized. But the emotional intelligence, that's something that's a little bit harder to teach. So thank you guys. Any negative stuff you want to say about the Academy? Be honest.
I don't have any, but I believe it's going to get better. Like we are the first set,
Yep.
and a lot of improvement. By the way, guys, the school is accredited, so if you want to come in,
Yeah.
you are not going to regret it. You have great teachers, great instructor, and people is going to put you through. You want to try it, CRA Academy. You're not going to regret it.
So one more thing that I think I would add to it is if you're looking for a job right now, there's one area that people don't really pay attention to, is the clinical research. And where do you start? When you get your bachelor degree first, then go to CRA Academy. I've known a lot of people right now been calling me because there's so many things going on out there, but if you really want to do the right thing, go to it, because the CRA, one good thing about the CRA is that they have a in-house training, which is a plus. Other school, they will teach you online, and that's it. So right now, we flew all the way from Atlanta to California.
Yeah.
We did the first 3 days in San Bernardino. Right now, we're in Hiring, so you cannot ask for more than that. And this is free.
That's right. And
all the staff are very friendly.
That's right.
Yeah.
That's right.
Yeah.
So thank you guys very much for watching. Thank you, Guru Nation. Thank you, YouTube. We'll be in touch for sure. Thank you, Eddie, and Facebook Live. And we'll talk to you guys later. Dan from theclinicaltrialsguru.com. Take care.
All right.
Thanks, guys.
Good, man. Hit the road, man. Hit the road, birthday boy.
All right.